Hey everyone, welcome or welcome back to my channel. My name is Nurse Melissa and this is the Lucky Nurse Lectures. So in this lecture video, we are going to be covering congestive heart failure, or just heart failure for short. In case you've heard the term congestive heart failure and you're not sure how it differs from heart failure, they are interchangeable terms, so they are the same thing. So in this video, I'm going to define what heart failure is, what the causes of heart failure can be. We're going to talk about different risk factors associated with heart failure and the signs and symptoms to look out for and treatment methods. So first we're going to start with defining exactly what heart failure is. So heart failure, also known as congestive heart failure, is a condition that develops when a heart is not able to pump enough blood to support the body's needs. So in my previous lecture videos, we've been covering the circulatory system and the heart, and I did go over some of the very important functions of the heart. One very important function is that the heart is responsible for pumping oxygenated blood throughout the body in order to provide oxygen and to perfuse major organs. So heart failure happens when the heart is not able to do some of those important functions that it is supposed to do. And so this typically happens either when the heart isn't able to fill up with enough blood for proper circulation throughout the body, or when the heart is able to fill up with enough blood, but it's too weak to properly pump out that blood in order to distribute the blood into the rest of the body. So, of course, blood is very important for our bodies because it has multiple functions. Like I went over in previous lecture videos, blood helps to transport oxygen and nutrients throughout the body, and most importantly, to all of our major organs. Blood helps with the removal of waste and waste products in the body. Blood also works to help fight infections in the body and to carry and regulate hormones in the body. So, if a person is in heart failure and their heart is not able to pump out enough blood to carry out all of these important functions, then their body will not be able to function properly. So, what causes heart failure? Heart failure does not just randomly occur in the body. Heart failure is more often than not caused by another condition that develops into heart failure. And there are many health conditions that can eventually lead to heart failure, but some of the main ones are listed on this slide, so we're going to go through them. We have coronary artery disease, for short CAD. And coronary artery disease is when the arteries that supply blood to the heart narrow, so they get smaller, making it harder for blood to pass through those arteries. And when this happens, the heart has to work significantly harder just to do its normal job of pumping out blood. And so over time, this weakens the muscles in the heart and leads to heart failure or congestive heart failure. Next, we have myocardial infarction, which is just a fancy word for heart attack. Some people call it an MI in healthcare, but MI or a heart attack can scar the tissue in the heart. The scar tissue creates extra unnecessary layers in the heart, and then that makes it harder for the heart to pump out blood, which can lead to heart failure. We have hypertension, fancy word for high blood pressure. And so with hypertension, it increases the amount of pressure on the heart's artery walls, which can lead to heart failure. Then we have heart valve disease, where the valves in the heart do not close properly, and this creates a backflow in the heart. And so the way that the heart works, blood is supposed to only flow in one direction. So the backflow that is created with heart valve disease creates a situation where the chambers of the heart are not filling completely, or they're not filling properly. And so that leads to heart failure. And so in my previous video, I did cover how blood is supposed to flow through the heart. It's supposed to be a one-way system. So if heart valve disease occurs and blood starts backing up, it can really mess up things. Now, congenital heart disease, congenital means present at birth. So unfortunately, there are just some individuals who are born with heart defects or with abnormalities in their heart that eventually develop into heart failure. And then lastly, we have atrial fibrillation, or AFib, which is a very common type of irregular heart rhythm. And if left untreated, AFib can develop into heart failure. So now, heart failure signs and symptoms. I don't want to talk too much about signs and symptoms in this lecture video because there's right-sided heart failure and left-sided heart failure. And those two things, even though they're both heart failure, they have different signs and symptoms. I do plan to make a separate lecture video talking about the differences between left-sided and right-sided heart failure. So in this slide, I'm just going to quickly go over general signs that you may see when someone is in heart failure. So some common signs and symptoms of heart failure include shortness of breath, generalized edema. So that means swelling throughout the entire body. Someone will just appear to be puffy and bloated, especially in their extremities, like their hands and their feet. There will be rapid and unexplainable weight gain. So like more than 2 to 3 pounds in a day or 5 pounds in a week. And then in some cases, patients will experience chest pain, especially if the heart failure is caused by a traumatic event like a myocardial infarction or a heart attack. So now risk factors associated with heart failure. When it comes to risk factors for heart failure, there are modifiable risk factors and then there are non-modifiable risk factors. So modifiable risk factors are factors and behaviors that can be eliminated or changed in order to reduce a person's likelihood of developing heart failure. Non-modifiable risk factors, they, let me start over. Okay, so now we're going to cover risk factors for heart failure. When it comes to risk factors for heart failure, there are modifiable risk factors and then there are non-modifiable risk factors. So modifiable risk factors are behaviors or exposures that can be eliminated or changed in order to reduce a person's likelihood of developing heart failure. So non-modifiable risk factors are things that can increase a person's risk of developing heart failure, but it's not something that we can control. So they would include a person's age. As we age, our hearts naturally just become less efficient, unfortunately, and the likelihood of developing heart failure increases. Sex. So men are generally at a higher risk for developing heart. Another one is sex. Men are generally at a higher risk of developing heart failure than women are. That is just the trend. There is family history. Unfortunately, some people are just genetically predisposed to developing certain conditions. So if a close family member, like a parent or a sibling, has heart failure, then a person is at a higher risk of developing heart failure themselves. Then we have race and ethnicity. Just like with family history, some people of certain ethnicities are at an increased risk of developing heart failure. African Americans and South Asians have a higher risk of developing heart failure. And now, like I said, those risk factors are non-modifiable. We can't change our genetic disposition. We cannot change our age or decrease our age. We can't change our family history. So if you do fall under this category that makes you at a higher risk of developing heart failure, even though there's nothing that you can do about it, it's just good to be made aware of it so that maybe you can change certain modifiable risk factors. Now, with modifiable risk factors, these are things that can be changed in order to lower the risk of developing heart failure. So modifiable risk factors include hypertension. There are medications that can help to lower blood pressure and control the blood pressure. Lifestyle and dietary changes can also be made to lower blood pressure. High cholesterol. So just like high blood pressure can be managed through medications or lifestyle changes, so can cholesterol. Obesity and smoking are two things that increase the risk of developing a lot of diseases, and heart failure is just one of them. And then lastly, there is lifestyle. So this includes diet, lifestyle, exercise, alcohol consumption, and even stress levels. So improving diet with nutrient-rich foods and eliminating processed foods helps lower the risk of developing heart failure. And then increasing the amount of exercise that you do, especially cardiovascular exercises like walking or jogging, can help to lower the risk of developing heart failure. And cutting out stress. If you have any unnecessary stress, maybe at a job or people in your life, cutting those things out can help to lower the risk of developing heart failure. So unfortunately, there is no cure for heart failure. So damage that has already been done to the heart cannot be reversed. But There are treatments that can help to manage symptoms associated with heart failure and treatments that can help to stop further damage from happening, or at the very least, slow down further damage from happening to the heart. So some of these changes include lifestyle changes. So like I mentioned, modifying diet or eliminating different stress factors can help to reduce, symptoms and signs associated with heart failure. There are medications that can help to alleviate some of the issues caused by heart failure. So, as you're learning in your nursing classes, diuretics can help to remove fluid from the body and combat fluid retention. So, when I talked about signs and symptoms, a person gaining weight or being like having generalized edema, that is fluid that is built up in the body and fluid that's pooling in the body. So, diuretic medications can help patients urinate and diurese to get out some of that excess fluid. We also have ACEs and ARBs, which can help heart function, and it helps the heart to just pump more efficiently. We have vasodilators that can help to dilate or expand blood vessels just to help blood flow a little bit easier. And then there are devices that can help to treat heart failure. So the implantation of like a pacemaker or the use of a defibrillator, those are two devices that can help to control a person's heart rhythm, especially when the heart has gone into heart failure. And then lastly, the most invasive option would be surgery. So there's bypass surgery. In more advanced cases of heart failure, we also have the option of having a heart transplant or a valve replacement. And so that was just an overall rundown of congestive heart failure or heart failure. If you have any questions, please feel free to comment down below and check out my other lecture videos, especially the ones on the cardiovascular system. Thank you guys so much for watching, and I will see you in my next video.